Hey guys, what's up? So I've had a lot of questions and a lot of things people have wanted to know about belly button piercings. So I decided to make an official video. I also have another video that you guys can look at, but this is just going to be the basic information. So I'm going to start off with all you need to know about belly button piercing care. Everything will be located right here that I say in this video, and if it's too much, then I'm going to link you to my blog on MySpace or a blog on blogspot.com. So, I want to let you all know first that I'm not a professional. I do not do piercings with other people. I do not do piercings on myself. I'm not a doctor. I'm not here to give you medical advice and medical opinions, because if you have an infection, you should see a doctor. Like, in a serious infection, you should see a doctor instead of relying on this video. So, I'm going to start off with the things that a lot of you wanted to know, which is the price. Honestly, the price varies. Oops, sorry guys. The price varies. I got mine for $40, but one place that I called is up to $120. So you just have to call and find out ahead of time. Also, you want to be sure to call and make an appointment, because that way, if they take appointments, you can be sure you can get in there, get out there as quick as you can, or if you want to. And you also have to make sure they accept your age, because if you're under 18, some places, won't always accept you. So the place, you can get your piercing at tattoo/piercing shops usually. Some places will even have banners in their window that says, we do piercings and tattoos, so you can always go in there and check them out. For the pain, from 1 to 10, mine was about a 6. The only reason why I think it hurt that much was because the lady didn't seem to know what she was doing, and she stuck the needle in really, really slow. So you just want to, maybe watch them do someone else's piercing, or just be prepared that if they don't know what they're doing, it's going to hurt more. Okay, so some questions, specific questions. When can I change my piercing? So it really depends on each person. You're supposed to wait till there's no irritation, no pus, no blood, it doesn't stick, you can move it freely without any pain, and you want to be confident enough to the point where it's healed so you can change your piercing. Otherwise, you may have a relapse. Me, I may have changed it a little too soon, I'm not quite sure, because it's sticking a little bit right now, and it's kind of getting infected, so I'm going to cover that in a minute. For those of you who want to know if blood or pus is normal, yes, blood and pus are normal, on and off, but it usually happens during infection or a disturbance. Yeah, I'll start the food when she gets here. Or a disturbance. But if you follow the cleaning ritual I give you and it still does not go away, please see your doctor, because that's not normal. I'm reading off a paper, so I make sure I have everything. Sorry, guys. So, cleaning ritual. Oh wait, no. Can my friend or can I pierce it myself? Yes. But do I recommend it? Absolutely not. Because if you do not professional pierce it, it may go in wrong, it may be crooked. There's a lot more chances it's going to get infected because you do not have sterile equipment, you do not have a sterile room. The people usually do not sterilize their hands correctly first, and so you're definitely more prone to infection, as well as what else? Yeah, it's just not good. So if you get it professionally done, you want to get it professionally done, someone who's trained, because less chances of getting a scar and stuff. I'm going to give you tips, tricks, and warnings, and pros and cons, and then I'm going to show you the cleaning ritual. You want to clean your piercing with something disposable, so you don't want to clean it with a cloth, and I definitely do not recommend anything with harsh fibers like paper towels. Kleenex is not really harsh, but I'd recommend it, and cotton balls. The number one thing I recommend is a Q-tip, like so. The ones that are cheaper are actually better because they have a tight grip around the stick, so it's not loose, so that when you clean it, it won't snag on your piercing, and it's really easy to get in and out of the bar. Do not touch your piercing. I know it's really addicting. I touched mine a lot and it ended up getting infected, so do not touch it. It's a bad idea. If you do touch it and you really cannot resist yourself, wash, sterilize, and put tons of alcohol, cleaning alcohol, hydrogen peroxide on your hands before you do that. You want to turn and move your piercing twice daily, so move it up and down, to make sure the skin doesn't grow around and it gets stuck in there. Because if that does happen, you may have to get it surgically removed, and they do scar over sometimes, so you really want to be careful that you go to a professional place, because if you do it wrong, you may have to end up getting surgery. They recommend not to go swimming or in a hot tub for 2 weeks after the piercing, because the irritation may occur, it may infect it, blah blah blah. Pools aren't really sterile, and they have lots of, well, if they are sterile, they have way too much chlorine anyways. I don't know if it's about pools as much as it is hot tubs, but definitely just try to avoid both if you can. If you ever use products on your belly button, you want to use unscented, uncolored products, because if you use colored and scented products, they may cause an allergic reaction or some kind of problem that you don't want. You can buy jewelry online, mall, or other stores, especially the places that you get your piercings at. Some sites that I found online, just as examples, are bellybling.net, bodycandy.com, and Sexy Navel Rings, I think it is. I wrote wings, but I'm pretty sure it's rings.com. So the cons of your piercing, I'm saying this really quickly, sorry, I have a lot to say. They snag if you have a dangly piercing, so that kind of sucks. They get infected easily, they require lots of care. Sometimes it hurts if you lay on your stomach. If it gets infected, it will most likely leave a scar. You can check out my how to change your belly button piercing video, and I will also be downloading a live demonstration once my belly button piercing heals more. I'm not going to lie, my piercing is kind of a little bit infected right now because I changed it too soon. But I know it was because of that, because it's completely sterile. So, cleaning your piercing. I'm going to read the directions to you and then I'm going to show you. So, about 3 to 4 times daily during the first few months specifically, you want to clean around the area and the bar itself with Bactine solution. This is Bactine solution. It's a first aid antiseptic liquid. It can be purchased at drugstores for about $5. You can shower like normal, but I recommend using a non-colored, non-scented soap on your stomach area. My recommendation, but it really doesn't matter. Once a day or less, you can soak your piercing. Wait, less or more, so it's really up to you. They recommend, I don't remember how much they recommend it. I never really did it until it got infected, but it definitely helps to soak your belly button in salt water. Now, I believe they recommended sea salt or something like that, but I used Himalayan salt and it worked fine. You can usually buy salt soaks at the store, but make sure they are unscented without color. Once again, you can also usually get a bag of it from your piercing place, and you can purchase them there. Yeah. So let's get started. Okay. Let's get the show on the road. And no, I'm not. Okay, as for the belly button piercing, please, guys, I don't want you guys to, think I'm trying to, get naked stuff for you. I'm trying to help you because I've had a lot of questions. So, the first thing you want to do is make sure your hands are clean. I already washed my hands prior to this, I think. Yeah, I did. Take your Q-tips. Try not to hold them by the tip, because if you hold them by the tip, more prone to getting them dirt and infected. I'm just going to stand up, might as well. Okay, so here's my belly button piercing. What you're going to do is you're going to take your 2 Q-tips, and if you have to, I don't have a surface right now over the sink, but you want to pour Bactine solution onto them to the point where they're soaked. The first thing that I do is, without moving the piercing, I go around it because bacteria crawls. So, this gets it. I also go into my belly button. Okay, now when moving your belly button piercing ring, you definitely want to move it. You pinch the skin around it, and at the bottom of the jewelry, you push it up. Now I'm cleaning around the bar. Then with the tip of the other side, you push it back into your stomach. It hurts a little bit, I'm not going to lie. Especially if you get infected. You swirl your, when you push it out and the bar showing, like so, you swirl the Q-tip around in a circular motion to clean off anything. Okay, there we go. Now is a good time to move your piercing, because after it's been cleaned and it's wet and slippery, then it's easier to move and it hurts less. So, the thing is, yeah, it kind of hurts right now for me because I just changed it and it kind of hurts. That's all there really is to say. And it itches, and itching is a good sign. It means it's healing. Just try not to touch it and not to itch it. And if you do, don't do that. I just do. Just pick your nose. Wash your hands and maybe just rub it with a Q-tip or something. Just try to be careful. So that's my advice for you. I hope this was somewhat helpful. If you have any questions, you can ask me, but I'm not here to give you specific medical advice. So if you have any specific, what kind of medicine you should buy if it hurts too much or something, I can't answer that. Oh, but I can say that If it hurts, you can take an Advil or ibuprofen or something for the first few days. I recommend it because it sometimes hurts a lot. It gets really sore. So that's what I recommend. But I'm not saying you can do it because I'm not a doctor, so I can't say that. But you get what I'm saying. So thank you guys for watching, and I will talk to you later.